So we're moving on. It's Adaptive Equipment and Caregiving Corner. I'm Christina. This is
And
Cindy.
I'm Cindy. Yes.
We are the co-founders of Adaptive Equipment and Caregiving Corner. We have a YouTube channel, and we would love it if you would, right now,
Yes.
go to our YouTube channel, click the subscribe button. It's free.
Yep.
And you become a member of the Corner Crew.
Yep.
How awesome is that?
And you get alerts whenever we put out new information.
Yes.
And if you like the content that we're providing, please go do that. And while you're there, hit the like button too.
That's right. And share it if you know somebody.
That's right.
Maybe this doesn't apply to you, but maybe you know somebody. So, share it with your friends that maybe it might apply to.
Mm-hmm.
So what we're talking about today is the 5 tips for preparing for knee replacement surgery. And we're on tip number 3.
Mm-hmm.
Tip number 3 is line up your recovery team.
That's right.
Yeah. Did you know you have a whole team?
Yes.
That's awesome.
Yes.
How supportive that sounds.
Right.
Yeah. So tell us a little bit about who might be on our team, Sin.
Yep. So you're going to, of course, want to get all kinds of information from your therapist and the doctor. You know, if you have any post-surgical things that you need, to follow. You need to, they're going to tell you what your weight-bearing status is. They're going to tell you what assistive device, like a walker, you're going to be on. So doctor, you need to line up any family members, maybe home health. A lot of times home health will come out after a surgery like that.
Yeah.
And then, some of that goes through the social worker at work. Yeah. The other thing is that, you want to line up a family member or a friend to maybe get your mail, to make sure that you get meals, anything like that. And then when you're talking about lining up stuff, I have had in my past, there's been on occasion, a few of my clients that have come home and don't really have a lot of people to help their support system.
Yep.
But they have talked to their postal worker, and the postal worker will make sure that mail comes up to the door.
It's such a great idea.
Yeah, it's great. And then they also prepare in advance by getting those things that they might need for like a 2-week period, because usually it's about 2 weeks before you go back for your post-op visit with your surgeon.
Yeah.
So we're talking, toilet paper and groceries, and maybe prepare some frozen meals ahead and things like that you can put in the microwave. If you've got pets, think about, what are you going to do as far as feeding them and watering them? Maybe there is, I know that there's these things out there, that there's bowls that have extended handles on them.
Yeah.
Or if
the pet bowls.
Yes. Or if you have a cat and you need to scoop the kitty box, litter box, there's long-handled scoops. So all of those things, especially if you don't have a big support system at home, or friends or family that are close by, those are things you need to think about preparing ahead of time.
Something too that I thought about was transportation.
Yes.
Don't wait till the last minute before your surgery to get that lined up.
Right.
When you might have a neighbor or a family member or a friend that could take you to your surgery.
Yeah.
I mean, it sounds
bring you
obvious,
back,
but I think some people get so wrapped up in the whole, it's surgery.
Right.
That you maybe forget to.
And then to take you
get there and get back.
Right. And to line somebody up to take you to your post-operative surgery or follow-up.
Yeah, your follow-up visit. Yeah, absolutely.
Because that's very important. The doctor needs to see you.